You found Ask Alice, the podcast that takes a deep dive into the societal currents shaping our lives. I'm your host, Alice, and together we'll explore the often unseen forces at play. We'll examine cutting-edge research, dissect the data, and most importantly, if you're seeking to understand what's shaping our society,
we're looking at a stack of sources today, really centered on this big initiative that's, well, shaking things up in American health policy. The Make America Healthy Again plan. These documents seem to link it closely with HHS Secretary Robert F. Kennedy Jr.
Right. And for this deep dive, our mission is pretty specific. We're using your sources to really unpack how this plan and, recent policy shifts at HHS directly hit the health and well-being of pregnant women.
Yeah, think of this as your guide, basically, to what this material is telling us.
Exactly. So let's start with the big picture the sources paint.
Okay.
They lay out MAHA's broad goals: tackling chronic disease, cutting down environmental toxins, nutrition reform, a real emphasis on prevention.
And the sources do acknowledge, right, that in theory, these things could benefit pregnant women, addressing underlying health, reducing exposures.
Absolutely, theoretically. But here's where the sources pivot pretty quickly. They move from those broad ideas to some, very specific concerns and direct impacts that seem maybe less positive.
Or even concerning.
Yeah, definitely concerning based on what's in here.
Okay, so what's the first big one? I saw something about COVID vaccines.
Yes, exactly. The sources zero in on a really notable change made back in May 2025 regarding COVID-19 vaccine recommendations specifically for pregnant women.
What was the change?
It shifted from a routine recommendation, basically get the vaccine, to the vaccine may be given, framed around shared decision-making between patient and doctor.
Okay, and the reasoning behind that, according to the sources?
Well, the stated rationale mentioned a lack of data for repeat boosters in children, and that reasoning was sort of extended to pregnant women.
But what really jumped out at me in the sources was the pushback they documented.
Oh, absolutely. Strong counter-arguments cited from groups like ACOG, the obstetricians and gynecologists, and the AAP, the pediatricians.
Right. They were saying the science hasn't actually changed.
Exactly. They're emphasizing the known risks of getting COVID during pregnancy and also the benefits, the protection passed on to newborns through maternal vaccination.
And the sources also mentioned something about the process, how this decision was made.
Yeah, that's a key point. They note this decision reportedly bypassed the standard CDC ACIP process. That's the usual independent expert panel review.
Huh?
And there's a practical fallout mentioned, too, the potential for reduced insurance coverage, which could mean out-of-pocket costs.
Which is always a barrier to access, potentially.
Definitely.
Okay, so that's vaccines. What else are the sources flagging? Something about infrastructure.
Yes. Concerns about the actual systems in place to support maternal health. The sources mentioned potential defunding or even removal of programs like Maternal Mortality Review Committees, MMRCs.
And Perinatal Quality Collaboratives, PQCs.
Those two. And these aren't just acronyms, right? The sources stress these are absolutely vital. They're how states investigate why women are dying from pregnancy-related causes and figure out how to stop it.
Especially given the disparities the sources point out.
Exactly. You can't fix the problem if you dismantle the tools you use to understand it.
And this is happening alongside broader changes at HHS. The sources mentioned staffing.
Yeah, significant staff cuts reported something like 20,000 total across HHS. And the Maternal and Child Health Bureau specifically facing maybe a 20% cut and being sort of folded into a new structure.
So the sources are raising questions about what that means for, specialized maternal and child health focus going forward.
Precisely. And they also touch on reproductive health policies more broadly. Things like potential support for reinstating the Title X gag rule, which restricts what providers can discuss.
Limiting comprehensive care access.
Right. And also initiating a safety review of mifepristone, despite, according to the sources, established evidence of its safety. Actions that, the sources argue, could further limit options.
And all this, the sources remind us, is happening when the U.S. already has, frankly, terrible maternal mortality rates compared to other wealthy nations.
Terrible and deeply unequal. The sources cite the data, Black women being 2.5 to 3 times more likely to die than white women in recent years. It's stark.
So the argument presented in these sources is that these policies potentially limiting access, weakening data collection like the MMRCs, reducing specialized staff could actually make those disparities worse.
That's the core concern they raise, yes. Worsening an already critical situation.
The sources also noted some scientific scrutiny around MAHA and maybe a lack of specific focus on maternal health.
Yeah, they point out that the focus on chronic disease, while important, might overshadow the acute risks specific to pregnancy. And they also mentioned the flagship MAHA report itself faced criticism.
For what?
For reportedly citing studies that, well, reviewers claimed either didn't exist or were misinterpreted. That obviously raises questions about the evidence base.
Okay, so wrapping up this deep dive based on your sources, MAHA has these big, ambitious goals.
Right, broad goals. But the specific actions and shifts detailed in these materials, particularly for pregnant women, raise pretty significant flags.
Flags about access to care, the strength of essential programs.
And a potential disconnect from, established scientific consensus or processes, all against that backdrop of the maternal mortality crisis.
So it really leaves you with a provocative thought, doesn't it? When you're aiming to reshape national health, what does it mean for the most vulnerable, like pregnant women, if the policy direction described in these sources seems to pull away from the very systems designed to protect them and address those deep inequities?
Yeah, that's definitely